Mornings are always beautiful here on Impact Television because we have tea or sometimes we have coffee. You're welcome to Tea or Coffee this beautiful Wednesday morning here on Impact Television, your first full HD television. And today I won't forget, my name is Oluwaseun Olusegun, and in the studio with me is the beautiful, gorgeous, sensational Wuraola. Now I'm going to call you Wokwola.
Thank you for all the compliments. Thank you so much.
My pleasure.
You know, when you said I would not forget,
Yeah.
I was just wishing and hoping you would.
I made that mental note not to forget because I always forget.
I like the fact that you're so excited, on the show this morning. And I am also, you know, being on Tea or Coffee.
It's always exciting. You know,
Yes.
this couch.
Especially
it's
knowing that you're going to learn something new on
yeah,
the show every day. It's quite
that's
exciting.
a good part.
Yeah.
How are you? How well did you sleep today?
Okay, the last time I learned that you
How was your night? Yes.
How was your night? Fine, no problem. I slept well. Thank you.
Okay. Did you see me your dreams?
No, my dear. I never had the plan to.
I come with beautiful memories.
Okay, so.
Oh, well.
Yeah, so what's happening today?
We have a bit of a sad story.
Yeah,
yesterday,
and honestly, I really did not want us to start the show with
sadly
anything sad because we are supposed to be excited on Tea or Coffee every time. But then we can't just avoid the fact that, okay, it happened and it was not evitable, you know. But so sad. Tosin Bokno.
Yeah, in case you're wondering what we're talking about, it's the passing of Tosin Bokno. She was an OAP and sadly, she was 37 years old, and she was such a burst of good energy and
OAP,
vibe.
Like she's a bundle of so many
talent, a bundle of talent. She was multi-talented. She was versatile. She was a beautiful soul. You know, I didn't get to know her personally, but then I saw some of her clips before. Now, of course, I know her
from the fact that I think yesterday so many things about her that I didn't get to know started unfolding. The fact that she's a writer, she's an actress,
singer,
she sings. I saw the video yesterday.
Yes.
She is joyful, playful, and I mean, how do you think of leaving someone in the morning and then by night you do not find? Because I'm talking of her husband, because the story was that the husband left her at home in the morning to go to work, and then coming back, he found her there. That was quite sad, you know. And
according
I
to
also learned, okay, you go.
Yeah, according to the sister, Funke Bokno, she said she passed away due to sickle cell complications.
Yes.
Which is further saddening because sickle cell, as you know, is as a result of the genotype SS, and that one is another story of its own because it is a genotype that could be avoided, you know. Usually it is brought on as a result of AS, the genotype AS, and AS getting married. And which brings me to the question for today. Why do you have to get married when you're both AS?
But we have to look at it from another angle of which most people are not aware. That is why we keep emphasizing on you being aware of your health.
Yes.
Take note of your health. You won't be surprised if, I won't be surprised if a lot of people have actually not gone to check their genotype. And it is quite important.
That was shameful.
Like,
I consider it shameful. Exactly. This is 2018, almost 2019.
You go through the process of, okay, we're getting married, love, wedding, and you're just excited about the wedding and all of that. But then a lot of things, I think couple actually should always check their genotype. Go and check yourself.
Mandatory. In fact, don't even say couples. Don't even say before getting married. Before you start catching feelings. Because we know there are people who say, well, that's because you don't have any idea of how much it can hurt when you lost someone to the bone and then you just have to get separated because you're both AS. Before you start catching feelings, once you see a prospect in that person, please, in fact, that you should always know, everybody should know their genotype because, you know, anybody can be AS, anybody can be AA, anybody can be SS. But once you know that you are AS, in fact, that should be a point of call.
Yes,
you know,
exactly,
always
because
ask.
at the end of the day, these children are the ones who suffer the pain and
terrible.
go through this pain. Honestly, even you as the parent, I'm sure you would get...
It is painful.
You can't stand to watch the kind of pain they go through.
Yeah, and
so why not just avoid it in the first place?
And you know that fear, that constant fear that a complication could develop and this could be really terrible, that could take the life of this your beloved child away. I think nobody should live in that fear. So please always check your genotype and your blood group too. That is very important. We will go on a short break now, and when we come back, we will be delving into today's topic of discussion on tea or coffee. Please don't go anywhere. We'll be right back.
Exclusive to High Impact Television.
Flying family vacation? Want to have a memorable time with your loved ones? Enjoy a season of family adventure this Yuletide at High Impact Planet's Amusement Park and Resort with up to 20% discount for park tickets and amazing family packages. Event highlights include karaoke night, African night, family games night, Christmas and New Year carnival, praise blast gospel concerts featuring some of Nigeria's finest gospel artists. Friday, the special guest at our prestigious Majors Lounge, comedy night, and family treats at our tastefully furnished apartments. This package runs from the 16th of December 2018 to the 6th of January 2019. High Impact Planet. Fun just got real.
I'm delighted to welcome you and be your host on another exciting episode of Legends. Contribute in our own little quarter, in any way we can, to the development of our society. I'm still your host, Victoria.
Exclusive to High Impact Television.
Jeg skal bli pappa, da.
Går det bra, eller?
Ja, det går fint.
Hei, du har kommet til toget. Jeg kan dessverre ikke ta telefonen akkurat nå, men legger igjen en beskjed.
Ja, jeg vet ikke hva jeg gjør. Jeg bare
Ok, nå kan vi da.
Ja.
Jeg har ringt, og jeg har fødebrev. Kan jeg slippe inn først?
Et lite øyeblikk, så må vi ta en av gangen her.
Nei, men det kan ikke vel stå.
Veldig bra. Puster du deg rolig gjennom redet.
Det er riktig.
Jeg skal finne noe som du kan klemme. Jeg skal finne... Ja!
Meg? Ja, hvem er det som er jeg som skal ha gjort det? Men det er noen som har gjort det. Ja, men det er ikke henne. Så hvis vi skal være veldig, veldig pirkete, så er det faktisk deg.
Du kan sitte på meg.
Okay, welcome back from that break. It's still Tea or Coffee on High Impact Television. You know, before we went on the break show, we were talking about Tosin Bucknor that died. You know, may her soul rest in peace. Perfect. It's so sad, you know, but some things can just be inevitable. You know, it's sad to know that she passed on yesterday, and an on-air personality, vibrant one at that. So may your soul rest in perfect peace.
No. And we know that you're in a better place. We definitely know that. Okay, so now moving on, to our topic for today, which is neurological rehabilitation. One of the topics you made. Yes, one of the topics, I mean, would be having two different segments today on the show, but first, let's talk about neurological rehabilitation. But then, as you know, we cannot do the talking because we are not professional in the field. And right here in the studio, we have our guest. He is Muyiwa Dejugbagbe, a neurophysiotherapist, and would be doing justice to the topic. Good morning. Good morning.
You're welcome to Tea or Coffee.
Yeah.
Thank you for coming.
Yes, thank you.
First, before we dive into everything that neurological rehabilitation entails, What is neurological rehabilitation?
Okay, thank you very much. Also, I really love this place. The ambience is actually very much fun.
Thank you.
My very first time coming to High Impact TV.
Oh, you're welcome.
Wonderful facility. At least I enjoyed everything.
Thank you.
Okay, straight to the talk of the day, neurological rehabilitation.
Yes.
Just let me first start with what rehabilitation is all about.
Okay.
So I would just like to actually divide this one. So we have and we have habilitation.
Okay.
Habilitation is about abilities, those things that you actually get to do, whether instrumental or basic activities of daily living. Like what you're doing right now, this is what you do, it's more of your occupational activities and everything. So when we're saying rehabilitation, so we're trying to say we are retraining those, let me say, those abilities that you actually have inherent in you.
Okay.
I get what was taken away as a result of trauma or a particular disease.
Wow.
So we're trying to get the person functionally independent and get the person to optimize, his or her own, let me say, well-being. So that is just what rehabilitation is. And when it comes to, let me say, the very simpler term. Now, neurological, because we actually have orthopedic rehabilitation, where someone actually suffered. Yeah, you see it maybe on the sport, and maybe Messi or Ronaldo having one particular injury, and they say, okay, the person is going through a rehabilitation of the anterior cruciate ligament that has been torn.
Okay.
So, but with this one we're talking about now, neurological, we're talking about whether the damage, I get now, is to the let me say now, the nervous system. And what makes up the nervous system, we're talking about the brain and the spinal cord. I get me now, and the cranial nerves, the peripheral nerves, everything that actually is responsible for the coordination of activities that is going on in the body. So any kind of those damage, which can be very much, can bring about a lot of debilitating effect, bring the person back, movement is impaired, the person can't function as he used to be. So that's when we now start bringing about rehabilitation of this person, so that to get the person back to the pre-injury status. So that's actually what neurological rehabilitation is all about.
Okay, so as a neurophysiotherapist, what do you do?
Okay, thank you very much. At least, physiotherapists are not just only the one that is responsible for neurological rehabilitation.
Okay.
It's like a lot of experts are actually very much involved in that. We have the occupational therapist.
Okay.
We have the neurosurgeon, especially if one actually has to be maybe someone that suffered traumatic brain injury. The person we actually have to see a neurosurgeon. We have the neurologist. Neurologists, we actually get to know the integrity. Let's say how far this person is actually recovering. Let me say the neuroplasticity and what have you. Prescribing some drugs that we actually hate. That is the physician, the aspect. We have the physiotherapist. Gone are those days where we used to actually have, let me say, bubunishe. Let me use that word. One person.
No, because of our international.
No, instead of you just get one person taking care of everything, general practitioner. So now we have different specialties when it comes to physiotherapy. So that's why when I get to have the neurophysiotherapists that are very much in charge of that. We have the prosthetist, and the orthotist. They are the ones, okay, this person we actually need a back support, a lumbosacral support. This person will need, I think maybe what we saw the governor of Ekiti, one time that was on a particular. So those are the ones responsible. All this kind of neck collar, cervical collar, and what have you. All this kind of, the person needs to get some orthotic devices. They are the one responsible for that. Speech therapists and audiologists, especially someone that actually suffered stroke. And this is a person that used to speak freely, but the person is now becoming, is aphasic, cannot really pronounce, even cannot, whether receptively or expressively, the person cannot express himself or herself. So we actually get to have a speech therapist in that particular area. We have the medical social workers. So we actually, it's a Catholic. Yeah, it's a broad field. It's not just about the physiotherapists alone. So it's everybody, it's a multidisciplinary approach. It is an interdisciplinary approach, and it's a transdisciplinary approach. So it's not just one person. It even involves the relatives of the patient, because you give them whole programs. Come on, get to do this. So let me now, because now I'm a physiotherapist. What we actually get to do, back then when we were in secondary school, at the primary school, we used to have this acronym for characteristics of living things.
Oh, yes, Mr. Niger.
Mr. Niger.
But now some people are actually saying...
it's La now, Mr. Niger.
Yeah, Mr. Niger La. Because now they say the first L for limited size, the other L, they say it's for lifespan. That's where you actually have your D. Give birth to someone, adolescence, puberty, all this kind of stuff to when the person dies. And we have the A for adaptation, and we have C for competition. But now, why do you think M, the very first letter, is, what does that stand for, if I may ask?
Movement.
Movement, I guess.
And that is what physiotherapy is all about. We are the, let me say, the protagonists when it comes to rehabilitating movement disorder. We are the one, because movement is life. No matter how, let me say, your pulmonary system is working fine, your circulatory, but if the movement is impaired, you can't move. Just like the person becomes lethargic, the person is labile, docile, and the person is not doing anything at all. So when it comes to movement and, let me say, rehabilitating a patient, so most of the time we take three systems altogether: the neuro, musculoskeletal system.
Okay.
Now, the nervous system.
You need to break that down.
Yeah, no, look at this. Let me just try and split it because like three compound, three words, being fused together.
Yes.
We have the nervous system.
Okay.
We have the muscular system. And we have the skeletal system. Okay. So that's everything being fused together. That's where the physiotherapy actually comes in. They say, okay, we are going to bring about to bring the person to an optimal functional well-being to a particular level whereby the person is independent, irrespective of, let me say, the impairment. And not just only for rehabilitation. Even physiotherapists are very much responsible for habilitation, prevention and promotion of, it's not when you're sick that you need a physiotherapist.
Yes.
Of course, you get to know Messi. Messi, at least one of our professors was telling that he actually has about 4 physiotherapists actually attending to him alone.
Wow.
For each of the legs. So it's just not when you get injured that we now start. No. Even a lot of, what are those things to actually prevent injury? So that's actually what physiotherapy is all about. Okay. So basically about movement and promoting, let me say, functional well-being.
Wow, that is one comprehensive definition of neurological rehabilitation. Now, talking about neurological rehabilitation and how you've defined that, what are the should I say diseases now, or the medical conditions, that can need medical rehabilitation?
Thank you very much. I was expecting that. If you're looking at those conditions, when it comes to neurological impairments, or let me say diseases, I said something from the definition. Those are the things that can be caused by disease or trauma. Okay. Any kind of physical, any kind of high impact energy on the part, that's what we call trauma.
Okay.
And disease can actually be infection, it can be inflammation, it can be an autoimmune disease. Now, there are actually over 600 of these conditions, I tell you. Wow. So it's a very broad. So just imagine, there's something called unimmune palsy. Actually, I know you.
What is that?
Yeah, what is that? We call it Saturday night palsy. Actually, after some people, you're enjoying the weekend.
Okay.
Some people like excessive drink, and next day they will just, sleep, and they do their hands awkwardly. Now, you placing your hand awkwardly for a very long time. And I say the person wakes up and say he's feeling some bit of tingling sensation.
Oh, yeah.
We call that paresthesia. It's basically, I can't actually get to do some things like I'm having some kind of funny sensations.
Yeah.
Yorubas, they call it baja.
Yeah, I know that word.
So those kind of things is neurological because it's your nerve. Now, I was saying that part of the structures that become affected, we have the brain and the spinal cord, and we also have the peripheral nerve. So that's actually a typical example of an affectation of the radial nerve. Okay. Now, we have stroke, which is very, very popular.
Yes.
Of course, I was just getting to, when I was preparing for this, about 6 million deaths from stroke every year globally.
Really? The number is that high?
I tell you, very, very terrible one. And we have other ones, even this autism, we actually, there's a lot of canvassing and a lot of advocacy is actually going on for this particular, they said autism, you talk about even Parkinson's disease. I know you remember Muhammad Ali and you talk about so a lot of these things, and spinal cord injury. That's where the aspect of trauma, traumatic brain injury. Someone that used to actually be very much, we have the ones that actually autoimmune. Autoimmune says that the person is fine, the body, thank you very much. It's actually very subtle. The immune system that's meant to actually combat, let me say, the antigens, and it's attacking itself. It recognizes its own structure as if it's the enemy. I get you now. I actually had a couple of this thing of such, and I tell you, it's a very, very debilitating condition whereby we try to use a lot of steroid and everything, and the rehabilitation is quite a very long-lasting. So even for children too, cerebral palsy. I know something that you get to see a baby and you said, okay, how old is this baby? And we just came for the naming ceremony about, let me say, 10 months ago. And you say, okay, what happened? Your baby can't sit. Just stay back in the baby. Because this baby is presented with delayed developmental milestone. Are you with me now? So it can actually affect the younger, or let me say, the pediatric population, that is the children. I get me, which can be congenital, that's right from why the baby is inside the womb, and it can actually have maybe a middle age, even the elderly person. So neurological condition, over 600 of them, I get me now, it affects, let me say, all across lifespan. So we can actually start talking about it, but I tell you, it's going to be a lot of time needed for that.
Okay, but are there natural factors that could lead to those conditions you just mentioned now?
Yeah, like actually, because there are some things when science cannot really get to explain, we say it's idiopathic. That we don't, it's an unknown cause. Like if you look at Guillain-Barré syndrome now, GBS, or we're talking about transverse myelitis. Transverse myelitis is just like, it's like a bit of inflammation going on in the spinal cord. So from the place of the affectation downward, that place is paralyzed.
Okay.
Actually, I get to have a client. We've been managing for, let me say, close to 2 years.
Wow.
And this patient, we have not even gotten a flicker yet. So it's quite a very, very terrible one when it comes to, when you get to keep, but what we do is that what you try to preserve so that the muscles will not actually deteriorate. So that, yes, eventually, a lot of rehabilitation, we have seen cases, depending on the severity of the condition. But if it's actually very severe, sometimes your rehabilitation might actually tend towards palliative, but it's very much important and better than when someone is not even doing anything at all. Because actually, I think, and that was one of those things we're actually conversing, we, the young physiotherapists, is that there was a patient I went to, and I met this patient, and I said, so for how long have you had stroke? He said, he has had stroke for 2 years. Okay. I said, have you been receiving physiotherapy treatment? He said no. I was like, oh no, I was bemused.
So what has he been doing?
One man came, and the man promised them that within 2 months, that is going to be fine. I tell you, this man is actually very educated. He has a university degree, so, and even the children, all of them are grown up. So, but because of the desperation and let me say that lack of awareness, and I think that's what Impact TV you are doing. I tell a lot of people actually saying this.
Yes,
is that because they need to be embellished with that necessary information so that they can make the right decision. I tell you, this man was asking, and he was telling me, said the man came and he will bring electric fish inside water. He will not just, they're still living, we put in the mask. So, because that produces current.
Okay.
So the hand will not move. You say, oh, come and see now. There's still power in that last hand. Very funny and quite unbelievable.
I feel like that's criminal. Because you're deceiving the person.
It's just
and guess how much this man spent just for like about how many sessions? 700,000 naira.
For something?
I was flabbergasted. I was like, wow, like seriously? The man, like, because he actually retired, almost all his pension benefits and everything. Because he wants to get well. And that desperation and the pressure from relatives and everything. What about the one that a client of mine was telling me? I did, and this is not just about, let me say, whether the outside people in the community. But we're even talking about even we in the medical. We don't really know what physiotherapists I get to know, what even other experts are doing.
Yes, medical
There was a person that came, when I was still very much working at the KJ then, and a client came, when we do this clicking. This,
we ask questions and all that.
Okay, ma, how are you? She was almost like folded, almost like folded all over, like 3 times folded. I was like, okay, you had stroke, at least I can see that from your case for how many years? 8 years. I said,
and she's not done anything about it for 8 years.
Which of the hospitals? He said, we went to one hospital, I will not mention name, and he said, the hospital, and he said that the doctor, after stabilizing the vitals, the BP, everything was very much normalized. They told the patient to go home. I said that just like malaria, it will start coming gradually.
What?
Like,
really?
Now, this woman was at home with a carer for 8 good years. There was atrophy. What I mean by atrophy? The muscles thinned out.
You lost in the use.
Everything was there. I was like saying, let me advise, don't tell you. But my boss had said, no, come on. We can only still get to do palliative physio, at least try to salvage that.
Yes, the one you have.
And so that advocacy is very much important. You have any neurological condition, you meet with your physician, your doctor, your consultant, and they just say, you tell them, please, what about me getting back? It's not just about stabilizing the vitals. What about me getting back to what I used to do? And I tell you a lot of times, evidence-based practice. I've managed clients that after, when they actually had stroke, they went back to driving, they went back to their, that's why sometimes there's this synergy. The occupational therapy is like taking you back to your occupation, to your pre-injury status and all. So why don't you just get to tell your doctor, what about my physiotherapist? What about my occupational therapist? What about my speech therapist, especially when the left hemisphere of the brain is affected, because that's actually where you have your speech center, and the person is aphasic, cannot speak. Why don't you just, the parents, the relatives, or let me say, the carer should actually get to start placing a demand on the healthcare system and say, what about we getting this done? I think we can actually get some extra care. Apart from just pharmacological intervention, taking drugs.
Yeah.
Drugs will not go to those legs.
Exactly. That is why, when people say, you think knowledge is expensive, then try ignorance.
That's right. Yes. No, I love that. Okay, let me just give you this last example. And then whenever I say it, I'm always very much, it's like something I want to try.
Okay.
I met this client of mine, he said his friend had stroke. And he said it's for 2 years now, but the man, they actually have this kind of hemiplegic gait pattern. You must have seen the hands and everything, and they move one kind of way. And he said the last time, because he said his childhood friend, and he's ready to do anything. Spent a lot of millions, and sometimes even our religious people, they actually, pastors and imams and everything, not leave anyone aside. And he said they will come pray. I said there was one that came, and I got a jar like this, and he said they should put frog, about maybe 2 or 1 frogs inside.
I'm picturing that
was
already.
dead for 3 days. Okay, now I think you're imagining something.
Yes,
and he said,
I am.
You should drink it. The man was telling me he was supposed to, and I told him, but when you are desperate, This does not live whether you are
a professor. And in the process of doing that, you bring up other health conditions, you know.
And I said, and the man came and I said, wow, this man has a very good prognosis. I wished just if it's an early intervention, it would have actually salvaged, and this man will have been very much fantastic. Yes, he might not actually get to be 100%, but 90% is still something that we can actually get to applaud.
Yes.
Now, why can't we just get to do that? But in this case, this man was busy drinking froggish water. Let me use that word. Froggish, no, terrible, stinking,
smelly,
smelly water.
Imagine.
Just because they want healing. And this person was paying exorbitant amount of money.
Oh my.
So actually, the traditional bone setters, the traditional healers, and all this kind of rehab, they are really bringing a lot of terrible things that the eye cell operation. You see some people folded all over. You see some people with some kind of scoliosis, ill-managed. And you wonder that, oh, come on, there is a country with laws and all. And people will not talk. They will say, Agba, for long, no.
That is no more. From now, you need to be aware, trust me. Because you can imagine, look at the case of...
take in, lots of information and lots of sad scenarios. That is really sad.
It's time that we begin to create awareness. Let people know that the earlier the better.
The earlier the better.
Exactly.
The earlier the better.
Okay, so how does an individual actually qualify for rehabilitation? Like, at what point? Because some people feel that, okay, you have to get to the point of maybe using wheelchair before you go to...
Exactly.
So at what point exactly should a patient come for rehabilitation?
Okay, thank you very much. And yeah, that is the misconception that we actually get to have, that, okay, you actually have to get to that latter end. But things are already, no. Okay. You know, why don't we just start from, that's why I said about physiotherapy, which is actually a major chunk of rehabilitation. It starts from even where you are very much healthy. That's why if you look at even the definition, like the whole definition, they say client and patient. Client is someone that is not, like you can actually be my client.
Yes.
I can be your own client. So it's not that you're actually bed-bound and you're actually on admission, no. So you can get to be that, you're even someone that is aging with every time, definitely, there's a kind of retrogression in a very, like the kind of declination in our functional performance. You can always get a physiotherapist to actually help your game. I get you now. So most people now, what they get to do is, I want to have flat tummy. And I want to have an humongous, backside, gluteal maximus. That's what people are saying. They say, I know what someone is trying to say, oh, you're a physiotherapist. Please, can you give me some exercises? I want to lose some belly fat. And I said,
really?
Yeah, I don't know. It's actually very good because it actually improves your core muscles. Okay. Abdominal fat being bariatric is not very good because
for vanity.
But it's actually much more than that. Apart from just the morphological distortion that you want to look pretty for someone or so. But what about we actually, something that is towards your health, therapeutic? I get you now. Therapeutic is towards something optimal well-being. So, and again, because prevention too is something that actually has to do with physiotherapy because, we want to prevent. If someone actually gets exercise, you engage in more physical activities, it reduces your chances of you actually having another kind of stroke. I get you now. Someone actually gets to, you exercise on day-to-day from, let me say, moderate, exercises like 4 times a week. It actually has this way of actually reducing the rate at which the person, let me say, the vulnerability of that person to get all this neurological disorder, because it has been proven, this WHO and the World Health Organization, that physical inactivity, sedentary lifestyle, all the time we get to sit down, we don't exercise. Someone told me, they said, what about, no, what do you mean I should be exercising? All the time with all this traffic in Lagos. I said, no. Don't get it confused. There's a difference between stress and exercise.
Yes.
So don't get it, because you said, oh, I trekked from Yanakwaja to... No, that's not... You are getting yourself stressed. That's distress for crying, because we actually have different types of stress. So you can have the huge stress, you can have distress. So that one is distress. That's not what we're talking about. But exercising, why don't you just get to register in one particular, or get a physiotherapist? So these are the exercises you will do. Get a bicycle ergometer. Get a treadmill. Try to do something that will actually increase your heart rate, that will really get you... It improves your mental alertness and even the rate at which your blood, your circulatory, let me say, integrity, everything is very much intact. So it's not just about when you are wheelchair bound that you now start looking for physiotherapist. Even right from birth. And I keep telling mummies and everything when they give birth, they say, try to start mapping out your children's development. At what age, at what month is this baby sitting down?
Yes.
Is it at 3 months? Because by 3-4 months, the baby should actually have neck control. You should be able to know that the neck will not start lagging and stick.
I think there are charts for that.
Yeah, they are. Yes. So these are the things, but people don't know. And you say, okay, so when it's even 9 months and this baby cannot even sit well,
that's true.
What I will support, and they don't even know. But the earlier we're able to do that, okay, can you just call a pediatric physiotherapy and say, please, this is actually a bit of derangement. I'm saying, is there a way we can actually get help with that?
Some people actually do not know the right person to approach or talk to.
That's true.
There are some kind of illness that the medical doctor will attend to, and not the do you understand? So some people...
let me give you an example of this. Like a client is a very high-profile client that came, and this man had Bell's palsy, facial palsy, one side of the face, paralyzed. And he called one of his friends, professor of neurology. The man said, okay, over the phone, said, oh, I'm outside the country now, but I tell you, you don't need much, of course, apart from the drugs I've actually prescribed to you. But you need to start seeing a physiotherapist. And it was like, amused, like, physiotherapy, come on, you are the professor of neurology. But we need to get to that level in Nigeria, whereby that's multidisciplinary.
Yes.
I keep preaching for it. All this kind of clean money, all this interdisciplinary rivalry of NMA, GSO, no, it's killing a lot of patients. You get to the ward sometimes, you will see a patient with pressure sore. And that's because they're not referring this person to the physiotherapist on time. Because physiotherapy will start, okay, let us start turning this patient. Like you are seated, on the bed for quite, let me say, a month. And that particular, your buttocks all the time is always on the back. So the patient now start getting softer and softer. Next thing, any small pressure, the thing will peel off. From there, the wound will start getting bigger. There was one I saw. I couldn't weep. It was the nurse was actually cleaning. If you see the wound, the ulcer, the buttocks, it was, that is actually what we canvass for. Wow. That everybody will actually have to come together to bring this patient, get the person back to the apogee of functional status, and this person get this person independent.
Okay, thank you so much, Dr. Physiotherapist. Thank you so much, Muyiwa Adejugbagbe, for
the expansion and a lot of that. I mean, I don't know about you out there, but right now I have this massive inflow of knowledge and, exposition, because there are a lot of things that we apparently need to know that we are not fully aware of. But then you trust us on our Impact TV, we always bring everything to the forefront. We're going to break now and we have more to come, so please don't go anywhere. We'll be right back.
Pop star on the planet. But today, for them, the centre of the universe is right here.
I met her in 1985. We got married in 1988. So we had like 3 years of courtship.
He can do feminine chores. I don't mean washing plates or whatever. He can come back from outside. He has gone to the market. He's bought meat, tomato, everything I need in the kitchen to cook. I said, go to the kitchen, I got some things. He would do this. Many men would not like to go to the market.
Well, I was in England and I got a message from her. And that message made me love her. Well, it was an exam result, and I didn't do too well before I left for England.
Oh, when the father died and I wrote him a letter of condolence, he started writing letters asking me, and I wasn't even sure whether I wanted to say yes. And I was dodging the question. I replied the letter, but I was dodging that question for a while. And this musician was singing at that time, fire, 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 get on. And they said this musician should stop singing that song. Maybe that was the cause of the outbreaks. So I told him that story. He said, That is not what I'm asking.
Your father is dead.
I want to learn Ushu.
You think you can master the art of ages? Wushu is a meditation. It's not made for hate or revenge.
Smuggling opium, kidnapping villagers for transport to forced labor. My daughter is priceless.
What do you know of my father?
He has brought nothing but pain and hardship to my people.
No! Isn't father wonderful?
Angels from the realms of glory, wing your flight around the
Have a season of family adventure this holiday. High Impact Planet. Fun just got real.
Hey, it's still to your coffee here on High Impact Television, and you know it's Wednesday, and we'll be talking about neurological rehabilitation with physiotherapist Muyiwa Adejugbagbe. So before we went on the break, we were talking about a whole lot when it regards to neurological rehabilitation. Now, are there, not to forget, please, the phone lines are now open, and in case you want to call him and then ask some questions, the number to call. Oh yes, contributions to thank you, Wura. The number to call in is 0705-143-2258. And in case you're not calling from Nigeria, you need to add the +234 code. Again, the number is 0705-143-2258.
And the number is on your screen.
Yes.
For you to watch.
And please don't forget to reduce or turn down the volume of your set so that we can hear you without interference. Okay, now back to you, physiotherapist Muyiwa. We were talking about a whole lot of conditions that can necessitate neurological rehabilitation. Now, is it possible that there are some medical conditions that make this neurological rehabilitation a lifetime measure?
Yes, quite a number of them.
Wow.
Especially when it involves, let me say, neurological disorder. Actually, there's a reason why it's called that, because like there's this thing that we actually have in literature, that the nerves, are you getting me now? When they get to recover, they recover at, let me say, 1 millimeter, I get me now, per day. I don't know whether you know 1 millimeter, like a meter, 1,000 of that, very tiny. So it actually has to be with you placing a demand on the body system. Gone are those days where we used to say, okay, if a part of the brain is damaged or if a part of the spinal cord is damaged, this person is gone for life. I get me now, because we believe that there's no regeneration. But so far so good, one of the novel things that we discovered is neuroplasticity, that the brain, the spinal cord is actually plastic. When you place a demand on it, by the exercises, by the, let me say, the rehabilitation protocols and regimen, you can actually get this person back to what he or she, used to do pre-injury. Now, talking about the duration, for someone actually, it depends on the severity. of that particular condition and how soon this person is seeking or this person actually sought for rehabilitation care. Now, there's a particular principle we always get to use. We have the FITT. Now, that is, the F stands for the frequency of the treatment. I get the intensity of the treatment, the type and the time of the treatment. So very, very much important. So someone actually gets to have stroke and you are treating this person just once, are you getting in a week or in 2 weeks? Which is something we actually get to see in many, let me say, public hospitals. Most likely this person will not actually get to. So you can see that it can actually take a protracted period of time, like going to months, years, and this person, Mommy, you have not got to where yet. But so that you actually have to place it there. That's why it's more of repetition and practice. Repetition, as like was taken on literature, that you have to repeat a particular movement 10,000 times before it becomes integrated into the central nervous system. So just imagine you just come for a session, treatment session, and just do your treatment, and you do one or two things, and the person, the next appointment is 2 weeks' time. And I tell you, it's going to be actually impossible. A lot of, let me say...
all right. Sorry to interrupt. We have a caller of Fuanayo. Hello, Ofo. How are you doing?
I'm fine. Good
morning. Good morning. Good morning.
Yeah.
Yes, you're on to tea or coffee.
Yeah, I want to make a contribution to this topic, neurological rehabilitation.
Yes, please. Hello.
Yeah, hello, good morning.
Good morning.
Yes, we can hear you.
We're listening.
Okay, I want to ask about spinal cord injury. I want to find out if it is under neurological rehabilitation.
Okay.
And then, I would like the speaker to throw some light on it. Because, I found out that, especially here in Nigeria, that once spinal cord injury patients are stabilized, they are just left at home, and they become, they become, in quote, very dependent on their caregivers.
Okay.
So I noticed that the caller.
Hello.
Yeah, good morning.
Okay, we can hear. Please go on.
Yeah.
All right.
Okay, thank you so much, Afo, for that. He said that spinal cord injury is also part of what could lead to neurological rehabilitation.
That's correct. Now, I mentioned that as a traumatic brain injury, TBI.
In a few words, because we need to move to the next segment.
Okay, the traumatic brain injury and also the spinal cord injury. So these are we've seen a lot of that, and with a lot of advances in neurological rehabilitation, we'll be having robotic therapy. Whereby we have this exoskeleton, we have in virtual reality, we have in a lot of, let me say, treatment models have been developed. So it's not just a static field, it's something that is evolving and it keeps getting better day by day. So these are the things that we are actually looking forward to.
All right, thank you so much, Noah Dejubagbe. Thank you for elaborating on the point and the topic for today, which is neurological rehabilitation. Okay, so we are moving to the next segment, which will be talking about health-seeking behaviors. And yes, definitely we have our guest in the studio also. He is Dr. Omotunde Green, a general health practitioner. Good morning.
Good morning.
Good morning, sir, and thank you for coming today.
Good morning. Thanks for having me.
Thank you. Okay, so what are the common health-seeking behaviors that you have come across as a general practitioner?
Maybe I should first of all let the people know what
health-seeking behavior. That's paramount.
Yes. Health-seeking behavior is a sequence of actions taken by an individual in the case of health, just to rectify the problem.
Okay.
If we want to talk about health-seeking behavior, you have to talk about it. Talking about it in all ramifications. Why am I saying that? The individual involved, the third party, which you call patient relatives, the healthcare giver, and then something like the prime movers, which I mean the government.
Oh, okay.
Because here in Africa, I will prefer to talk about it in a way, to educate our people, because it's a very serious issue. You may have a good health-seeking behavior, and that can only be seen in, let's say, 3% of the populace.
Wow.
but the bad health-seeking behavior is very much prevalent. Okay, so discussing the issue, although gradually I will open up the aspects where everybody has to. Let's take the individual, for example.
All right.
What you discover in this part of the world is when people fall ill, the first thing that comes to their mind is, okay, which way should I go? Which one is going to be cheaper, okay, and faster? Okay, but when you go to the Western world, every e-health, the individual is already, pointed in a direction.
Okay.
When they are sick, they go to hospitals.
Yes.
But here, when we are sick, it's unfortunate that the hospital is the last
place.
Okay, we were talking initially about neurological rehabilitation. I'm very sure the physiotherapist mentioned the fact that a lot of people don't come until it's so
end stage, yes.
Okay, so that's the problem with our health-seeking behavior. When we are sick, there are a lot of factors which I have mentioned. I have split it into 4 parts, which I'm going to talk about. Okay, then, we bring it on that way.
Okay.
So, if I get you correctly, if I'm to define or summarize it, I would say health-seeking behavior has to do with all the processes involved in you being concerned about your health, you seeking out, to protect your health, and also the preventive measures.
Yes.
And you mentioned how about 3% of the population seem to have the good habits, and then the prevalent one have the bad habits. Now, do you think there are factors, or definitely there will be factors affecting health-seeking behaviors? So what are those factors that make the prevalent population have bad health-seeking behaviors?
Thank you very much. The factors, for the sake of this discussion, so that the people out there can understand fully,
all right,
I said I'm going to talk each point based on 4 different factors. So let's come to the individual. Not all Nigerians live in Lagos. Or not all South Africans live in Joburg.
Yeah.
Okay? So one factor that determines your response, your behavior, has to do with the environment.
Okay.
That's true.
Okay? And, with the experience gathered over the years, I know that, a man who, let's say for example, in Ikirun in Osun State, if a man falls ill, let's say for example, like just malaria, okay, the first place to visit, I can assure you, is not the hospital.
Okay.
Okay.
In that part of Nigeria.
In that part of Nigeria.
Okay.
Okay. Maybe someone, and don't get it twisted, there are places, there are situations whereby even when you feel you live in Lagos, you still behave like, the example I'm trying to make. Let me give you an example. That was some years back. I was going to the island, so I entered a bus from the mainland. Okay, then when we entered, I didn't know the bus conductor is also an herb seller.
Okay.
And so she started advertising. Just immediately everybody settled in. Okay, and then I was just thinking within me that this woman is not going to sell today, because I saw the caliber of people in that bus. All of them were well dressed, just like our physiotherapist. And I felt, today, this one is not going to sell.
Yes.
But surprisingly, by the time we reached Obalende, I ended up being the only person in that bus who did not purchase that drug, that concoction. That can treat 1,000,001.
Exactly, that is the key word, 1,000,001. It's so scary. They feel like for you to be educated and literate, and someone tells you it can cure this, it can cure that, mentioning about 100.
That's because they're ignorant of the fact that you can walk to the hospital.
In fact, if we're off camera and I have to sample everybody's opinion, ask certain questions, you'll be surprised that
they find it cheaper also,
Yeah, so I have seen an army major whose wife delivered not even at a traditional birth home. It was, well, let me say it, a traditional birth home. Suffered complications from it. And a major in the army.
Wow.
The young lady too was educated. Okay? And then when I asked, why should we, lose this young lady in, under that circumstance? It's not as if you don't have money to pay for your health, because finance is another very huge challenge in fairness to the people. Like I said, the socio-economic factor is very, 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 very important.
Sure.
So when you look at the individual, I'm saying these things because it's a really serious issue. You see that I talk about it, then I say I do waivers, because I've seen people who have the money, and yet they didn't still act,
what you expect of them.
Yeah, what is expected of them. Okay, so the issue now, it's not only about your educational status only, or your financial status,
or your environment,
or your exposure. It's a multifaceted issue, problem. Okay, so how do we begin to ensure good health-seeking behaviors? So, going back to the first factor, which is the individual, which I have just talked about.
Yes.
The socio-economic factor, it's one of the contributory factors. Okay? The economic factors. Then, amazingly, in our environment, gender.
Okay.
Yeah.
I'm interested in that.
Yeah, thank you very much.
Explain.
Gender. It's been discovered that a female person, okay, may likely suffer complications from diseases that are meant to be seen as, meant to be treated at primary level. There are 3 levels of care. We have the primary level, the secondary level, and the tertiary level. Primary level are the ones that can be taken care of at the primary health care centers and all that. That doesn't require much. Let's say malaria. You'll be amazed that a lot of Nigerian women still die from pregnancy and from malaria in pregnancy. Okay? Because research has shown that as at the time the woman is having the first symptoms, it continues to cope.
Okay.
Continues to cope. Maybe he doesn't want to be seen as a troublesome person in the family who will go and spend the husband's money, at the hospital. Is he only you? Is he all the time that you have to... Despite the fact that she's pregnant and she's going through a lot.
Pains.
Okay? So, then it's men, on the contrary, after the first symptom and he can't function at work, at least he'll make a move, branch at a pharmacy close by, give me something to use. Okay, so that's one other thing. Okay, and when it comes to maternal and child health, you discover that a lot of things. You see the mother coping. He has not even told the husband that this child has been, passing water stool for days. Okay? There's someone, a woman like herself, who has advised her, use this, use that. Because the woman has given back to 8 children in the past, so she's now an authority. So whatever they say to you, then...
authority.
I can teach you from my experience.
Exactly.
Okay, from experience. So that's why I said gender. And there are other factors, that way. Then let's look at the second one, which I said the third party. I just mentioned a bit of it. That third-party influence is amazingly serious.
Okay.
It contributes very seriously to the challenge of bad health-seeking behaviors.
That would be the family or the significant other?
In fact, let me say, when I say third party, it's so broad.
Okay.
Okay? From your pastor to the chief imam,
that one.
to the babalawos.
When you say babalawos, you mean traditional?
Traditional, yes.
Yeah, sorry. I said, to the traditional. I have this picture, okay, because the audience might not be, so the concern about health, okay, usually it lies more, okay, in poverty, you know, concentrated areas.
About this because of our time.
Yes, okay. So this third-party influence is so amazing.
Okay.
There was a research carried out here. You know, this is a person of Ogun State in Nigeria.
Yes.
And it was discovered, okay, that 90%, if I'm sure, or 80-something% of women in that part of Ogun State, I think it was Shagamu, Uderemo, and that's where the research took place, delivers in TBAs.
Traditional birth.
You know, homes. Okay? I'm not saying this because the TBH, the traditional birth, is already integrated part of our primary health care now. Okay, because we don't have a control over them, whether we like it or not.
That's part of the reason why it was
whether we like it or not, people go there. So what the government is doing, some serious government is doing, is integrate them into healthcare practice. Okay, but I'm talking from the experience of care at the grassroots level. I'm a primary and a secondary care provider. Okay, so I see this. You know, I dubbed myself an eraser some times ago. When I talk to my colleagues, I say, my job is an eraser.
How is that?
Yeah, where I work, you see a lot of people. I don't see much of, people who are sick and then they leave their homes and then come straight to the hospital. No.
To the hospital, okay.
Okay, they have already been influenced, or, one way or the other, they've been to the pharmacy shop to take medication.
Self-medication.
They've been to the herbal drug person and take medication. And by the time they are coming, that thing you're supposed to treat as a primary illness is already complicated.
Sadly.
Okay. All right, because of our time, let's move straight to how this can actually be avoided. What can we do to, it's one thing for us to talk about it, and it's another thing for us to actually create solution to the problem. Now we know that a lot of people have the bad health seeking behavior. Now, how can we, help to curb that?
Education.
In few lines.
Education.
Okay.
The people has to be educated.
Okay.
I'm not talking about classroom education.
No, like this kind of education we have here.
Advocacy.
Yes.
Unfortunately, that has seriously dropped lately.
Okay.
You see a lot of people doing researches and then papers, okay, and at the end of the day, they make recommendations and then we drop it in the archives. No implementation, nobody cares the policies are not being implemented.
They're just on paper.
Yeah, they're just on paper. The people has to be educated. Individuals has to be educated.
Okay.
Third parties has to be educated. Okay? The environment, the healthcare professional. I have not had the opportunity of mentioning that. Somebody should ask me, how do we come by how do we come to affect the health-seeking behavior? Unfortunately, he mentioned something. I think I listened to it. I wasn't in the studio then. And then he said something about this interdisciplinary issues and all that. Okay? It's not only that. There are other
factors.
Disciplinary issues within the healthcare system that has to do with professionals who don't treat their patients right. You have an experience. You go to a general hospital, and then you are badly treated. Even the fact that you go there sick and there is no empathy, that's enough to not want you to go back there.
Yes.
Back
I'm sorry to cut you short. There was, sadly, we don't have so much time. I was just going to ask about the attitudes of healthcare professionals. There are some people who have this bad behavior as a result of the disposition of some of the healthcare providers. I've heard it severally, that the attitudes of the people and that it's because of that they don't really go out there, to seek for the health.
But our time is fast spent. Thank you so much. I think we need to invite you over again, to make this topic quite elaborate and talk more about it, because it is important that people are aware. Thank you so much, Dr. Omotunde Green. you really made the point. I'm sure people are aware now.
Yeah.
Thank you so much. Thank you so much, Muyiwa Dejibagbe, for coming also. All right, so that's it on this episode of Tea or Coffee. My name is Wura Olapopola.
And my name is Oluwaseun Olusegun.
All right, have a good day.
Bye.